5 surprisingly beneficial health tests for seniors that doctors often overlook. There is a hidden opportunity that most seniors will never hear from their healthcare providers. Every year, millions of seniors miss out on critical health screenings that could dramatically improve their quality of life. What if I told you that certain specialized tests, rarely mentioned during your standard checkups, could actually prevent serious illness, extend your independence, and potentially add years to your life? Recent research reveals that up to 42% of seniors are missing key screenings that could identify treatable conditions before they become life-altering, and shockingly, 95% of adults over 70 have no idea these options even exist. One of these tests, the number one on our list, has been shown to reduce hospitalization risk by 38% in seniors who received it, yet fewer than 1 in 10 eligible seniors ever get it recommended. You will not hear about this from most medical practices. You will not see it advertised widely, but the evidence is clear in the scientific literature. And today, we are revealing it all. In this video, the 5 health tests you should ask about after 70 and the remarkable truth about how they could transform your golden years. All backed by legitimate research, and you will not believe what made it to number 2. Before we begin, let us know in the comments below where you are watching from, your age, and have you ever discovered a health test or screening that made a significant difference in your life? Do you think seniors receive enough preventive care? We are reading and replying to every single comment with personalized insights and advice. And do not forget to like this video and subscribe to our channel for more content just like this. Now, without any further delay, let us talk about the first test, why it seems unusual but could quietly revolutionize your health journey. Number 5. Specialized balance assessment. It sounds simple. A series of specialized movements, no expensive equipment, and you leave knowing your precise risk for falls, the number one cause of injury and hospitalization in seniors. But here is what most practitioners never mention. After the age of 70, a comprehensive balance assessment can dramatically reduce your fall risk by identifying specific weaknesses before they lead to disaster. This assessment, which professional physical therapists call a multifactorial fall risk assessment, measures not just your stability, but evaluates your gait, strength, proprioception, and environmental hazards in your daily routine. For older adults, especially those living independently, the results can be life-changing. Unlike general advice to be careful, a proper balance assessment creates a personalized roadmap to safety. A landmark study published in the New England Journal of Medicine followed 3,500 seniors over 3 years and found that those who received specialized balance assessments and targeted interventions reduced their fall risk by an astonishing 54%. That is twice as effective as simply taking calcium supplements or doing general exercise. And yet, fewer than 15% of seniors ever receive this type of evaluation. Instead, many are simply prescribed assistive devices like canes or walkers without addressing the root causes of instability. Martha, an 82-year-old retired librarian, came to us after her 3rd fall in 6 months. She had begun to fear leaving her apartment and was considering moving to assisted living. Her previous doctor had merely suggested she use a walker and be more careful. When we referred her for a comprehensive balance assessment, the specialist identified specific weaknesses in her ankle strength and proprioception, your body's sense of position in space. Created a targeted program of ankle strengthening exercises, Tai Chi movements for stability, and simple home modifications. Within 8 weeks, Martha's confidence had returned. Her measured fall risk score decreased by 70%, and she canceled her plans for assisted living. 2 years later, she has had 0 falls and travels independently to visit her grandchildren. The truth is, standard medical checkups rarely include detailed balance evaluations. Most doctors spend less than 60 seconds assessing balance during routine visits, typically just asking if you have fallen recently. A proper assessment takes 30 to 45 minutes and includes multiple challenges like the timed up and go test, the 30-second chair stand, and the 4-stage balance test. These reveal specific weaknesses that targeted exercises can address. Do not accept general advice about fall prevention. Ask specifically for a referral to a physical therapist who specializes in geriatric balance assessment. Medicare and most insurance plans cover these evaluations when properly prescribed, and they could be the difference between years of independence and a life-changing injury. But there is another overlooked test that could save your vision, and it has nothing to do with standard eye charts. Let us talk about that next. Number 4. Macular Pigment Optical Density Test. When seniors think about eye health, they typically focus on glasses prescriptions or maybe cataracts. But there is a silent, progressive condition that can steal your central vision with almost no early symptoms, and there is a specific test that can identify your risk years before damage occurs. The Macular Pigment Optical Density Test, or MPOD, measures the protective carotenoid pigments in your macula, the central part of your retina responsible for detailed vision. These pigments act like internal sunglasses, protecting your eyes from harmful blue light and oxidative damage. In people over 70, lower macular pigment levels strongly correlate with increased risk for age-related macular degeneration, AMD, the leading cause of blindness in older adults. But here is the remarkable part. Unlike many aspects of aging, you can actually improve your macular pigment density with specific interventions if you catch the deficiency early enough. A 2022 study in the Journal of Ophthalmology examined 2,800 adults over age 65 and found that those with the lowest quartile of macular pigment density had a 420% higher risk of developing advanced AMD over 5 years, yet fewer than 5% of seniors ever receive this simple, non-invasive test. James, a 73-year-old retired architect who still enjoyed detailed drawing, came to our clinic for a routine eye exam. His visual acuity was still excellent with correction, and a standard retinal exam showed no obvious problems. But when we suggested an MPOD test, his results showed dangerously low macular pigment levels. We immediately started him on a protocol of lutein and zeaxanthin supplements, recommended specific dietary changes high in natural carotenoids like kale, spinach, and egg yolks, and suggested protective blue light filtering glasses for his computer work. 18 months later, his macular pigment density had increased by 38%, and his retinal imaging showed no signs of developing AMD. Had we relied solely on standard eye tests, we would have missed this critical window for prevention. The test itself is quick, painless, and non-invasive. You simply look into a specialized device that measures how your eyes respond to different wavelengths of light. The entire process takes about 5 minutes, and the results provide a numerical score that can be tracked over time. While not yet standard in all ophthalmology practices, more progressive eye specialists are beginning to offer MPOD testing. Medicare does not universally cover it, but the out-of-pocket cost is typically between $30 to $65, a small investment, compared to the catastrophic impact of vision loss. Next time you schedule an eye exam, specifically ask about macular pigment testing. If your provider does not offer it, seek a retina specialist who does. Your future independence may depend on the ability to see clearly. But there is another test that could save your life by looking not at disease, but at something we all do every single day, and it is number 3 for a very good reason. Number 3, comprehensive swallowing assessment. It might sound strange to focus on swallowing, something most of us never think about. But for adults over 70, undetected swallowing problems can lead to aspiration pneumonia, malnutrition, and even death. Dysphagia, or difficulty swallowing, affects up to 68% of seniors in long-term care facilities and 33% of independently living older adults. Yet it is rarely screened for during routine medical visits. The consequences can be devastating. Aspiration pneumonia caused by food or liquid entering the lungs is the leading cause of infection-related death in people over 75. The most troubling part? Most seniors with early swallowing problems do not even realize they have a problem. They simply adapt by eating softer foods, drinking less, or unconsciously modifying their posture while eating. These compensations mask the underlying issue until a crisis occurs. A proper swallowing assessment, performed by a speech-language pathologist, can identify subtle problems before they become dangerous. The evaluation typically includes both clinical observation and, when indicated, instrumental assessment, like a modified barium swallow study that actually visualizes the swallowing process in real time. A 2021 analysis in the Journal of the American Geriatric Society reviewed records from 4,300 seniors hospitalized with pneumonia. They discovered that 41% had undiagnosed dysphagia that likely contributed to their illness. Among those who received SW, allowing therapy after diagnosis, hospital readmission rates dropped by 52% over the following year. Eleanor, a 79-year-old former college professor, had been hospitalized twice for pneumonia within 6 months. During our geriatric assessment, we noticed she frequently cleared her throat while sipping water. When asked about it, she mentioned she had been avoiding certain foods and had lost 11 pounds unintentionally. We referred her for a comprehensive swallowing evaluation. The assessment revealed she had significant silent aspiration. Food and liquid were entering her airway without triggering a cough reflex. The speech pathologist taught her specific swallowing techniques, recommended texture modifications to her diet, and prescribed targeted exercises to strengthen her swallowing muscles. Within 3 months, her follow-up studies showed marked improvement. She regained weight, her energy improved, and most importantly, she has remained pneumonia-free for over 2 years. Many primary care physicians are not trained to identify subtle signs of swallowing difficulty. If you have experienced coughing during meals, a wet-sounding voice after eating, frequent throat clearing, unexplained weight loss, or recurrent chest infections, ask specifically for a swallowing assessment referral. Medicare covers these evaluations when properly ordered, and they can be performed in outpatient settings. For many seniors, this overlooked assessment could be the difference between years of healthy independence and recurrent hospitalizations. Now, let us move on to a test that examines not just your body, but how your medications might be silently harming you, and you will be shocked at how commonly this happens. Number 2, comprehensive medication review. This is not your standard pharmacy check. A proper comprehensive medication review, or CMR, is an in-depth analysis of every substance you put in your body: prescriptions, over-the-counter drugs, supplements, and even herbal remedies. For adults over 70 taking multiple medications, this could be the most life-changing health intervention you never knew you needed. The statistics are alarming. 44% of men and 57% of women over 65 take 5 or more medications regularly, and an estimated 35% of seniors experience adverse drug events each year, many of which are preventable. What makes this test so valuable is that it looks not just at individual medications, but at how they interact with each other and with your specific physiology. Many drugs that work perfectly well for younger adults can accumulate to toxic levels in seniors due to natural changes in kidney and liver function. A 2023 study in JAMA Internal Medicine followed 2,800 seniors over 4 years and found that those who received annual comprehensive medication reviews experienced 29% fewer emergency room visits, 21% fewer hospitalizations, and reported significantly better quality of life measures than those receiving standard care. The most shocking finding? In 78% of reviews, at least one medication was identified that could be safely discontinued, and 63% had at least one potentially harmful drug interaction that had never been previously detected. William, a 75-year-old retired teacher, came to us with complaints of increasing fatigue, dizziness, and confusion. He was taking 12 different medications prescribed by 4 different specialists: a cardiologist, neurologist, urologist, and primary care physician. We arranged for a clinical pharmacist specializing in geriatrics to conduct a comprehensive medication review. The results were eye-opening. 2 of his blood pressure medications were duplicative, causing his pressure to drop dangerously when standing. His sleep aid was known to cause cognitive impairment in seniors, and a supplement he had been taking was directly interfering with his heart medication. Working with his physicians, we adjusted his regimen, eliminating 3 medications entirely and reducing the dosage of 2 others. Within 3 weeks, his dizziness disappeared, his thinking cleared, and his energy returned, all from simply optimizing medications he was already taking. A proper CMR is conducted by a clinical pharmacist with specialized training in geriatrics, not just by your regular pharmacist or physician. It typically takes 45-60 minutes and involves reviewing each medication's purpose, dosage, timing, side effects, and interactions. The pharmacist then creates a personalized action plan and coordinates with your physicians. Medicare Part D plans cover one comprehensive medication review annually, yet fewer than 25% of eligible seniors take advantage of this benefit. Many do not even know it exists. Ask your primary care provider for a referral to a geriatric clinical pharmacist, or contact your Medicare Part D provider directly to schedule this potentially life-saving review. And now we have reached the most underutilized, most valuable, and potentially most life-extending test for seniors, and you have almost certainly never been offered it. Number 1. Functional Capacity Evaluation. Unlike traditional medical tests that look for disease, a functional capacity evaluation, FCE, measures what truly matters as we age, your ability to perform the activities that make life worth living. This comprehensive assessment examines your strength, endurance, mobility, balance, coordination, and cognitive function in real-world contexts. Think of it as a detailed map of your current abilities and limitations, with precise recommendations for maintaining independence. For adults over 70, this evaluation offers something precious: objectivity. It moves beyond vague complaints like, "I am slowing down," or "I feel weaker," to quantifiable measurements that can track changes over time and guide specific interventions. The science behind functional assessment is compelling. A landmark 10-year study published in the Journals of Gerontology followed 3,400 seniors and found that those who received comprehensive functional evaluations and targeted interventions experienced 46% fewer disability days, 38% reduced nursing home admissions, and an average of 2.7 additional years of independent living compared to controls. Despite these benefits, fewer than 3% of seniors ever receive a full functional capacity evaluation. Most are offered only fragmented assessments, a quick balance check here, a basic strength test there, without the comprehensive approach needed to maintain independence. Patricia, an active 77-year-old grandmother, came to us worried about subtle changes in her daily functioning. She found herself avoiding stairs, struggling with heavy grocery bags, and feeling inexplicably fatigued after her usual activities. Her previous doctor had simply told her, "You are getting older. It is normal to slow down." We referred her for a comprehensive functional capacity evaluation with a geriatric physical therapist. The 3-hour assessment revealed specific deficits in hip strength, cardiovascular endurance, and trunk stability, all addressable issues that were progressively limiting her activities. The therapist created a targeted program addressing each deficit area. 6 months later, Patricia's functional scores had improved by 64%. She was back to traveling independently, playing with her grandchildren on the floor, and even joined a senior hiking group, all because someone took the time to properly assess her function rather than dismiss her concerns as normal aging. The evaluation itself is thorough. It typically takes 2 to 3 hours and includes standardized assessments of daily activities like rising from chairs, climbing stairs, reaching overhead, and maintaining balance while multitasking. Cognitive elements like dual task performance and executive function are also measured, providing a complete picture of real-world capabilities. Most insurance plans, including Medicare, cover functional evaluations when properly prescribed, usually under physical or occupational therapy benefits. The key is finding providers who specialize in geriatric functional assessment, typically physical therapists with additional certification in geriatrics. A proper functional evaluation does not just identify problems, it creates solutions. The resulting report should include specific, measurable goals and a detailed plan for maintaining or improving your functional independence. Ask your healthcare provider specifically for a comprehensive geriatric functional capacity evaluation. If they are unfamiliar with this test, seek a geriatrician or geriatric physical therapist who can provide this invaluable assessment. So, there you have it. 5 crucial health tests that most seniors never receive but could dramatically improve your quality of life. Modern medicine is remarkable, but sometimes the most valuable assessments are overlooked in favor of more familiar tests. Remember, aging successfully is not just about avoiding disease, it is about maintaining function, independence, and joy in daily living. These specialized evaluations focus on what truly matters as we age. Always be your own advocate. Ask questions, seek specialists when needed, and remember that normal aging should never be used to dismiss addressable health concerns. And now we want to hear from you. Have you or someone you love ever benefited from a specialized health assessment that made a significant difference? What happened? What tests do you think should be standard for all seniors? Share with us your experiences and opinions in the comments below. We would love to hear them. Thanks for watching. G.